Sustainability is defined as the degree to which a process is able to be maintained or continued while avoiding the long-term depletion of natural resources. It's essentially about meeting the needs of current generations without compromising the needs of future ones. But how does this apply to our everyday lives and practices as medical students? In 2018, a survey concluded that 98% of NHS staff believes that the healthcare system should be more sustainable. The healthcare industry has a huge carbon footprint, contributing to an estimated 4.4% of net carbon dioxide emissions globally, with the NHS contributing to 4% of England's CO2 emissions. These values have a large-scale impact on the world and subsequently human health, through climate change, resource depletion, social inequality, and more. The General Medical Council's Good Medical Practice highlights the need to manage resources effectively and sustainably as part of the professionalism domain. It specifically highlights making good use of resources available and actively choosing sustainable solutions. The GMC's Outcomes for Graduates also highlights that doctors should apply knowledge about sustainable healthcare to medical practice, and talks about the importance of seeking ways to improve the use and prioritization of resources. The Centre for Sustainable Healthcare has identified 4 key principles that underpin sustainable clinical practice: prevention, patient empowerment and self-care, lean service delivery, and low-carbon alternatives. Sustainability is also included as part of the Department of Health and Social Care's 10-year plan for the NHS, which mentions that the NHS will be expected to take more measures to reduce its environmental impact. In fact, the NHS itself intends to deliver the world's first net zero health service by 2045, in line with the government's overall 2050 net zero target. All of this demonstrates that not only is it an ethical and moral obligation to be sustainable, but it's also a professional one as healthcare providers. Now, let's talk about why. You may be familiar with the 4 ethical pillars of medicine. Justice is focused on both fair allocation of scarce resources and consideration of a doctor's wider duty to society. Allocating resources in a sustainable manner and reducing waste allows a doctor to fulfill this ethical obligation. This isn't strictly about reducing medical waste. For example, Barts Health NHS Trust enacted Operation TLC, an initiative to encourage doctors to turn off unused equipment, switch off lights, and close doors to save energy. CO2 emissions were cut to 34% of their original level, and savings of over £500,000 were made. This allowed these doctors to uphold the pillar of justice by considering their impact on wider society. Another way to think about it is from a public health perspective. The condition of the environment affects everyone around the UK and the world. The World Health Organization recognizes climate change as a threat to human health in a myriad of ways. The death and illness from extreme weather events, the effects of pollution causing and worsening disease, the disruption of food systems and on drinking water, the number of mental health issues, and the reduced access to healthcare. This is all reiterated by the Centre of Sustainable Healthcare, who state that our health is dependent on natural systems, which provide us with a stable environment to thrive in. It is our duty to maintain such an environment for our patients and ourselves. As stated by the GMC, one of the roles of doctors is to promote public health, and engaging in sustainable solutions is an effective way of doing that. This line of thinking can have more short-term and direct effects on individual patients, as well as from a public health scope. Not only can it prevent certain diseases and illness, but it can also promote more patient-centered approaches in medicine. In particular, air pollution is linked to worsening of the incidence and prognosis of asthma. This can lead to hospital admissions from exacerbation, consuming even more scarce resources and contributing to the carbon footprint and a positive multiplier effect. As the NHS is a major contributor to emissions, it follows that a reduction can lead to an improvement of health outcomes for this patient group, highlighting the importance of using resources sustainably. Something else to consider is that more environmentally beneficial methods do not necessarily compromise on patient care and safety. For example, social prescribing is a sustainable way to care for patients, as it encourages them to engage in community-based activities tailored to their needs, as opposed to providing solutions that are invasive or drug-related. This can help us cut down on 25% of the NHS's carbon emissions caused by medications, and also considers social and psychological factors affecting patient health, leading to more holistic treatment overall. Another example is conversations surrounding total intravenous anesthesia, or TIVA. Inhaled anesthetic gases and metered dose inhalers account for 5% of the NHS's carbon footprint, and some gases can have 100 to 1,000 more greenhouse effect emissions than carbon dioxide. TIVA has been found to have a carbon footprint of almost 4 times lower than inhaled anesthetic agents. It also has clinical advantages, including decreased post-operative nausea and vomiting, and offering a smoother and quicker return of consciousness compared to some inhaled gases. Multiple sources deem both methods of anesthetic as equally safe for patients. All of this proves how managing our resources with sustainability in mind can directly benefit our patients. As medical students, we have the duty to take on opportunities to demonstrate sustainable practices within the limits of our competency. There are a few ways in which we can do this. The first way is to stay educated. Sustainability in healthcare is a massive field which is constantly evolving. Continuing your professional development through conferences and webinars is a great way to stay aware. For those of you on placement, take the time to check your trust policies or sustainability plans, as there may be some takeaways for students too. If you want to take the initiative to make some positive differences in your community, audits and quality improvement projects are an accessible way for students to get involved. Data can be presented at conferences where your evaluations and interventions can be brought up to a wider group of people and maybe even implemented around the country. In a similar vein, lots of universities have societies that are based around this topic. If yours doesn't have one, why don't you start your own? Another way to contribute to sustainability is to speak up on placement. Don't be afraid to engage in conversations with staff about being greener. As long as sustainable solutions do not compromise on patient care and safety, it will always be worth having discussions about them. Everyone has their part to play when it comes to sustainability. NHS Wales talks about a Kaizen approach, which refers to continuous improvement and small incremental changes leading to significant long-term benefits for the workplace. This is a great way to think about your place in helping healthcare in the UK become greener and more sustainable without getting too overwhelmed at the thought of it. Your actions will lead to a bigger long-term effect overall. We hope that this video has helped you to understand why sustainability in healthcare is one of our duties as medical students and future doctors. Thanks for watching!